Welcome back to the TheCivDiv. Today we are going to be talking about a kind of more esoteric condition that not a lot of people know about, but a lot of people suffer from. Let's get into it.
Whiskey 9 Yankee 7 November Golf, over.
Bone spurs, also known as osteolytis, are bony projections that develop along the edge of the bones. They typically form where bones meet each other at the joints, but they can also occur in the spine, which is the biggest problem here. While many bone spurs can cause no symptoms, they sometimes can lead to pain, loss of motion, and complicating depending on the location, which can lead to nerve damage, especially if we're talking about them in the spine. So common affected areas, as I said, the spine is a big one. Hips, knees, and feet are the most prevalent among vets. So military service can be a significant factor in the development of bone spurs due to the physical demands placed on the service member. The activities such as marching, carrying heavy loads, and performing strenuous tasks can lead to osteoarthritis, where the cartilage cushioning the ends of the bones wears down. So I know a lot of us have suffered from that in our career. Well, that can lead to the form of bone spurs as the body tries to repair the cartilage loss. So the VA rates bone spurs using diagnostic codes for conditions with similar symptoms, because like many symptoms under the 38 CFR, there is no specific diagnostic code for bone spurs. So here are some common diagnosis codes used to render bone spurs as a condition. So the first being diagnostic code 5279, metatarsalgia, or Morton's disease. This is rated at 10% regardless of whether one or both feet are affected. Again, so Morton's disease are mostly directed towards the feet. Second one is diagnostic code 5002, multi-joint arthritis, which includes conditions like rheumatoid arthritis, osteoarthritis, and so on and so forth. The rating is under this code can range from 20 for 1 or 2 flare-ups per year to 100% to total incapacitation. The third diagnostic code is 5003, degenerative arthritis other than post-traumatic. So ratings can be from 10% for X-ray evidence involving 2 major or minor joints, and 20% if it involves 2 major or joint groups with occasional incapacitation exacerbations. For severe cases where bone spurs prevent you from working, you might be eligible for total disability individual unemployment, known as TDIU, if your condition meets this necessary criteria. Okay, so let's talk secondaries. Bone spurs can lead to several secondary conditions which might also be eligible for VA compensation. So these include chronic pain, nerve damage, and ankinosis, so basically reduced mobility. Bone spurs have been led to all of these. So, you having a bone spur in your spine, it can pinch nerves, cause numbness in your legs. You can have bone spurs in your hips that then lead to lowered mobility. All of those can cause other secondary conditions, or those conditions can be exacerbated by bone spurs. So, recommendation, just remember as you are thinking about filing this claim, what are the symptoms of the bone spurs and how they lead to different things outside of just pains in the joints. What is your mental state because of it? What are the other parts of the body is affected? These are questions that might lead to secondaries that might lead to higher rating. All right, guys, that's all I have for bone spurs. I know this is just one of those topics that not a lot of people really know about, but can lead to bigger ratings down the road. So, as always, this is Jay with the TheCivDiv. Stay informed, stay resilient, and I will see you next time.